artery zone, or the REZ, is the proximal 2 to 4 millimeter segment where the nerve connects to the brainstem, essentially the pons, serving as the primary site of neurovascular conflict in the description of classical trigeminal neuralgia. Which artery is most commonly implicated in the cause of trigeminal neuralgia? Choice A, anterior inferior cerebellar artery. Choice B, basilar artery. C, posterior inferior cerebellar artery. D, superior cerebellar artery. Or E, the vertebral artery. The answer is the superior cerebellar artery, or choice D in this particular case. The superior cerebellar artery is implicated in almost 75 to 90% of cases that involve neurovascular compression. The point of vulnerability is the transition between the central myelin versus the peripheral myelination of the nerve, and it's also called the Redlich-Obensteiner zone, which you see exiting the brainstem. The anterior inferior cerebellar artery, or the AICA, is the second most common cause. It's implicated in about 20-25% of cases. The basilar artery is very rarely related to this. The posterior inferior cerebellar artery, this is the most common choice that people make in the exam, and that's the wrong choice. In the cause of hemifacial spasms or glossopharyngeal neuralgia is more commonly associated with the pica. Vertebral artery is occasionally implicated, but that's not really the reason either. Historically, did you know that for almost 2000 years, the concept of trigeminal neuralgia has been talked about right from the times of Hippocrates. But in the late 1600s and early 1700s, the clinical descriptions became a little more concise. And the first sort of description was by Nicolas Andre, a French guy who described this in his paper, and he coined the term tic douloureux, which basically he thought was due to compression of the peripheral segments of the facial nerve. And he basically went about treating this by exposing the peripheral nerves and treating it with a caustic solution of mercury, which was the standard at that time. In 1773, the British physician scientist Fothergill basically talked about this in a little more detail. And John Hunter, another British physician scientist, basically put together a little more description of this particular condition. It took almost another 150 years in the modern age of medicine, where Walter Dandy, who a lot of things in neurosurgery have been attributed to, equated this to compression of like a neurovascular structure. The interesting thing is the trigeminal nerve root entry area, or the REZ. It's also called the Obersteiner-Redlich zone. This is the area in the prepontine cistern where the trigeminal nerve basically connects to the brainstem. There is an area of transition between the myelin produced by the oligodendrocytes versus the myelin produced by the Schwann cells. And that glial Schwann junction is the area that is most vulnerable for damage as a result of compression. And this is the area that tends to get affected most commonly in trigeminal neuralgia. And if you're going to get an MRI, the sequences that people talk about are called the Fiesta sequence or the CIS sequence. This is just extra information for you all. Thank you for watching, and we'll catch you on another episode of QOD. Thank you.